I want to show you a really nice Invisalign First before and after. I'm not even done with the case yet, so we'll say before in progress. But on the left, you see a patient who had overjet. There was not a posterior crossbite, but there was some crowding. Yes, we did have a diastema, but you can see the laterals don't have quite enough room to fit. The lower had some mild crowding. This patient, in my opinion, would be a lip sucker where you see a flattened the lower arch and some protrusion of the upper. So what we did was we used Invisalign First to simultaneously align the teeth, reduce the overjet, and expand the arch. So I want to show you the arch width table. And what you'll see is if you look in the area of the second molars, we went from 38 to 41, and the lower is 35 to 38. And you might be wondering, is it a dental tipping or is it a skeletal expansion? Well, I don't have an x-ray to show you a split suture, but what I can tell you is that you don't have to overthink it. You can look at the buccal segments and you can see that we don't really have much tipping. And our transverse occlusion looks fine. Anteriorly, of course, we have reduced the overjet, lined up the lower teeth, and improved the upper, and even got the lateral to erupt down. And this is not, I would say, a dramatic result, but the ease compared to a palate expander, a hyrax, and brackets, and the efficiency, and this was only 24 aligners. I saw the patient twice at 12-week intervals. And it does touch on something important. Sometimes orthodontists, we feel like we're craftsmen, we're artists, and we want to get in there and feel like we're doing it. But this is the way modern orthodontics, modern anything, surgeons, robots, if you can know how teeth move and program it effectively, and then have an easier appliance deliver that force without having to do as much instrumentation, and allow the patient to have a much easier experience without having a hyrax in the mouth, and the parents to have an easier experience without having to turn a device, that's the way to go. I hope you like this result. I do.